So Mercury is in retrograde, and I'm going to start with that. So this is just our couple times trying to get Dr. Barnett. So we're going to be chatting with her about the holistic approaches to breast implant illness and all the fun stuff that she does as an advocate. She is a breast implant illness advocate, and from what I've seen, she has just done so many lovely things, and that's really one of my favorite. That's one of my favorite things about her. When I had my my consultation with her, I just love that about her. So I'm laughing because we've just tried this so many times. But I know we're going to get there. And Dr. Barnett, you're a rock star. Hi, everybody. And I know she's trying to figure it out. We just keep going back and forth on the video chat, and we're going to try to get there. So I know everybody wants to hear from her. I know I do. I have lots of questions. So yay, Dr. Barnett, you're here. Yes, thank you. Oh, my goodness. We got her. All right.
I think
Yay!
we finally did it.
We finally did it, and yes, it was just,
Thanks to
oh my gosh, I was laughing.
Hey, Monica.
Thank you, guys. I was laughing. I'm like, I don't know if we're going to get anywhere.
Yes.
Who knows? Okay, so thank you. Thank you so much for joining us. Thank you so much. And we're going to have, I think we have a little bit of reverb because of the headset thing, but we're going to work around it, okay? So, Dr. Barnett, I was just saying that you did my explant prior to, I had seen you 2 months. You were just doing explants, this is 3 years ago. I was having fertility issues is how I actually stumbled up, upon breast implant illness. And I don't know if you knew this, but after almost 3 years of trying to get pregnant, you removed my implants, and I got pregnant in 3.5 weeks without even trying. It changed my life. So I have the most beautiful little boy because you helped me so much. So I'll try not to start sobbing my face off here, but it was amazing. And I was, on one of the many lives that we started, which was about 12, so far today. So let's see if anybody gets to this one. But I was actually saying that you had a really holistic approach, which was one of the reasons that I loved you. And I wanted to talk about that a little bit. I wanted to talk about your more holistic and, anything, any little bits you want to talk about.
I don't think you can separate out your body from your mind, from your emotions, from your spiritual life. We're all interconnected, not just with each other, but with the different parts of ourselves. So when I'm healthy physically, I find my emotions off balance, and it doesn't mean that if, for example, you're disabled, that you can't be a full person, but it does make life more challenging. So when I approach illness of any kind in myself or in patients, a lot of things are out of whack. People may not be eating well. They may not be taking care of their lives. I know for I get myself into emotional extremes. It often expresses itself in my body in a physical illness. So I think I have to pay attention to my emotions, not just to things like, what I eat, what I put in my body, but all that stuff. We're very social beings. We need social support. So, I haven't developed a coherent philosophy, but I
it sounds
think it's
like important. You have. It really seems that way. I'm going to sign up. I like it.
Well, I'm sure you've done a lot of work on yourself in many different ways.
Yeah, actually, I was, mentioning, I say that because some people might see some of the other chatting that I did while I was kind of trying to figure this out. But, I had severe anxiety after I breastfed my daughter. And then that's when all my breast implant illness really became noticeable to me. And it was such a shift from my normal kind of calm, confident feeling. I felt so insecure and extreme anxiety, and it was so different. And because it was coinciding with breastfeeding and just having a baby for the first time, I kind of blamed it on that. And it was really I think, extra anxious time for me because I felt so guilty that I wasn't euphoric about having a baby.
Uh-huh.
Instead, I felt
Yeah,
severe
yeah.
anxiety. So,
Well, there's a lot of
so
pressures
everything you're
that we
saying made
have
sense.
about being, well, sorry, there's a little skipping or something, but
Yeah.
there are pressures on us as women, as mothers, as business owners. So I don't know the answer to it, but because it's hard for me to stay in balance, but I do know I have to have good relationships and I have to take care of myself, not just my patients. So
Yes. And you're a
I
busy
like
lady,
to
so I hope that you are
exercise
doing
and
that. We have a little lag. I know it's a bummer. Okay, so I'll just try to talk a little
eat well,
slower so we can get around it.
to eat junk food. So, yeah, nope, that's not good.
Can anybody else hear that lag, or is it just us? I hope
Are we
everyone's
still
getting
on?
everything she's saying here. Yes. Can you hear me?
Oh, yes. It
Yes.
seems to be skipping
I
a little
know.
on my.
Mine too. So I'll wait a minute and give you a second to answer so that we can kind of get you. Sometimes the headset, and sometimes it's where you're at, and sometimes it's the weather.
All right, yeah, and Mercury retrograde.
So I wanted to ask you, you're a big BII advocate, and you were that way when I first met you, and I just loved that. I remember I left my implants there because you told me you were doing a lot of work for advocacy, and I thought, yes. And I know, what made you so passionate about that?
Well, over the years, seeing so many women suffering and so many women getting better, how can you not be passionate? I mean, that's why I went into medicine, because it allows me to help people, not because, yeah, well, I mean, it's great I can earn a living at it, but to me, life is so much more meaningful if you can help people. I don't think we're here just to earn money. So it's kind of funny. I don't know if I'd shared with you the story of how I came into plastic surgery. When I was young, I was a very ill child, and so I thought I wanted to be a doctor because I was tired of getting shots. I wanted to give them. I had a heart murmur when I was young, and I didn't grow. I was a failure to thrive. And back in those days,
Wow.
they couldn't do cardiac caths on a little baby, so they told my parents I had a bad heart and I wasn't going to make it past 5 years old. Well, obviously, I proved them wrong. It turned out the heart murmur was just a functional murmur, and
Wow.
it wasn't anything bad. But it was so bad, my mother said she couldn't hang out the white sheets. I thought it was a doctor on laundry day coming to give me a shot. I would start to cry. So when I grew up and wanted to be a doctor, no one in my family had been a doctor, and I was adopted, so I didn't know anything about my natural parents. So I thought it was because I was tired of being a patient. So I become a doctor, and I tracked down my natural parents, and I found out that my natural father was actually a doctor.
Wow.
So that was pretty neat, since I had no idea, and yet I wanted so strongly to be a doctor. And I didn't get to know him very well, but I found out he was a GP. Now that was interesting, because I think had I been born 20 years earlier, I would have gone into general practice, because I liked everything about medicine. And what happened, though, by the time I went into practice, they didn't let the GPs do a whole lot, like delivering babies or taking out appendixes. So I thought, well, I'll do general surgery, because this allows me to do a lot of surgery. Plus, no one says you can't prescribe insulin for diabetes.
Wow.
So I went into general surgery, and I was doing it through the military. And every time I would get engaged, they would ship me off to Timbuktu. So I thought, if I'm going to be a doctor in the Army, which I wanted to at that time, I would need to do a subspecialty, because once you have a subspecialty, they keep you in one of the major medical centers, and those are all in big cities. So that's good for a spouse rather than when you're off in, the wilds of Timbuktu. So I went back and I did plastic surgery pretty much for the same reason that I did general surgery. It allowed me to do a nice variety of things. I thought briefly about being a pediatric surgeon or a colorectal surgeon, but I just thought I would miss the variety, because you can do congenital birth defects, you can do reconstruction after cancer, and
Wow.
and then if you get tired and you have a family, you could do cosmetic surgery, which isn't so demanding. It's all pretty healthy patients. So I did plastics, a hand fellowship, and a microvascular fellowship, and then the Army still shipped me
Wow.
off to Timbuktu as a general surgeon. So that's when I left the military. But once you leave the military, you kind of have to pick a specialty. When I was there, they let me do anything I trained for. So at that point, I was getting out, and my days of reproducing were rapidly coming to an end. So I decided I'd better do plastic surgery instead of general surgery. And at the time, the place I practiced in, it was mostly very old people, so nobody had any cosmetic surgery. They were getting things like skin cancers taken off and breast reduction or breast reconstructions.
Wow.
And I was happy doing that until Medicare said they were going to cut reimbursements because they were spending too much. So they wanted to cut it by 5% per year for a 25% cut. Now, most of my colleagues said, well, that's crazy. We're going to go bankrupt if they cut us that much. But since I had been in the military, which is a government-run program, I realized, if the government says it's going to do something, they eventually get to it. So I decided I had to reevaluate my whole practice. At that point, I couldn't operate any quicker than I was, as I'm a pretty fast surgeon. And I didn't want to turn my practice into one of these assembly lines where I was just doing surgeries one after another. I think that's not healthy. So I had to make a hard decision, and I decided I needed to start cutting my Medicare patients and start doing more cosmetic surgery, like insurance stuff. Cosmetic surgery is what you and the patient decide is fair, and most people are very fair. I don't buy a new car every year, and I shop at Goodwill. So if I say to somebody, this is what it costs me, what I need in order to live, they're happy to give it to me because I'm not greedy. And I didn't think I would like it as much, because how can wrinkle cures or things like that compare to things like reconstructing missing limbs? But the older you get, the more you realize that, again, it's not just saving lives, it's quality of life. And also,
Yeah.
I had to remember that it was also about allowing me to serve. For example, if I'm too busy trying to make a living that I can't help somebody who comes to me who has no insurance, then I don't think that's a healthy thing either. So as a plastic surgeon, I was able to make a decent living without having to worry that every year Medicare was cutting me more. And I started getting, over the years, I've had many patients come to me with the breast implant illness. It was especially difficult in the 90s because, remember, there were the lawsuits, and so many of the women were very sick. We had over a quarter of women signed up for the global settlement. Now, most of those patients were the gel patients, and I thought with time, once the gels got off the market, we wouldn't see the implant illness, but I was wrong. It did quiet down for a while, but once social media came back in, I started seeing the patients with the saline implants who were just as sick as the gel patients. Yep. And so I, I didn't think that was going to be my focus, but what I found is so many of my colleagues don't believe the ladies that, unfortunately,
Yeah.
Many of them don't get good advice like removal of the capsule. They aren't given options. I don't think a lot of my colleagues really understand that. Sometimes the women just needed a lift. They didn't necessarily need to be bigger, you know?
Yeah, it's true. Well,
So,
you're a goodwill ambassador, and that makes sense to me. I mean, I
yeah.
love I love that. And that's really makes so much sense why, for me it was a good fit. Everything you say, I'm right on board with you. So, my husband calls me his Birkenstock hippie chick, but it's really, for me, that's what life is all about too. It's helping, and how can you serve and share the love, and we are all connected. And that's why I started my group, is because I'm on the other end of healing, because I've been a holistic wellness coach, and I was trying to heal myself, and then I ended up feeling amazing. And there was still a lot of women that were telling me they still felt bad after explant. And that's how I started. They'd message me, and I'd tell them what I did, and they'd feel great. And they'd message me, and I'd tell them, well, this is what I did. And then that's how the group, and we all just share info. It's my detox group, and it's really amazing. And it's like you mentioned, a lot of your colleagues don't believe in breast implant illness, and there's only a handful that truly do believe in breast implant illness. And there's a lot of them will keep the capsule in, or don't believe in the en bloc. And it's word of mouth, because so many women are getting a bad hand because they get a bad explant. And I see it all the time. Or women that have breast cancer are, really just kind of sailed down the river to get breast implants because that's what they think you're supposed to do. And then now they feel terrible all over again, and they've already battled this terrible cancer. And it just, it's hard, but it's hard to watch, obviously, but that's, social media is a beautiful tool. And then doctors like you, who truly believe and are grounded in the belief of truly healing and helping others. And that's just, it's refreshing, and it's wonderful. And I am so glad that you're giving us your time today. I do
Oh,
have
yeah.
I do have another
Sure.
question, and I just wanted to see, there a question that I see all the time on my group is, there's women that are thinking about getting implants that join, and then there's women that are thinking they may have it. And they always ask, well, where did you get diagnosed? And I say, there's no one diagnosing you, but I would love to know, what would you tell someone like that? Like, what are the symptoms, or what are the main things that you look for? Because you had a really great survey that I did, and I was
All
like,
right.
oh yeah, this is me. So, what are your thoughts
Well,
on that?
that's the tricky thing, because it can exhibit itself in so many different ways. But typically, most women have complaints of being unusually achy and stiff,
Yes,
muscle aches, joint aches, and fatigue is very common.
that was me.
Um,
Bad.
Brain fog is very common. Irritable bowel and irritable bladder are very
I've heard of
common.
that. I didn't have that, but
Dry
I've heard that. Hmm.
Yeah, dry eyes is very common. Visual changes, dizziness. I mean,
Yes.
the list is so extensive. I think that's why a lot of doctors don't want to believe it. They say, well, how can a
It
device
all be
cause
that.
all these different symptoms? But, as we're starting to understand a bit more about how the immune system works, and how um, one little glitch can throw all sorts of things off, then I think there are more and more people getting interested in this. And the big game changer was in 2011, when they realized the association between the textured implants and lymphoma.
Yeah.
Stuff like fatigue and achiness, since you can't measure it, that's easy to blow off. But lymphoma is very measurable. And the other thing that is unique about that is it's the first novel disease I've seen described since I left medical school 40 years ago.
Wow.
And what that means is, I mean, other than a few infectious diseases they discovered in Africa, but everybody knows how infectious disease works. This is something we've never seen before. So there's several labs that are very interested in solving it, because whoever does solve it will, of course, go down in the history books as, you know, It might be prizes and a lot of grant money too. So, for example, MD Anderson is coming out with some preliminary reports that perhaps it's related to a particular bacteria around the implant.
Hmm.
Now, the reason I think these things are important is whatever they find that is affecting lymphoma in women with textured implants, I think will be applicable for the women who don't have lymphoma but are ill, because I'm
Wow.
sure there are similar mechanisms behind both of those things. So
Yeah.
it's exciting times. I'm happy to see a lot more people taking this seriously. Even the FDA, as you know,
Yeah.
came out with a statement saying now they believe there are categories of women who suffer illness. So,
There was a big group
uh,
of women that went down there and really handed them their behind. So I am so grateful for that. I am so
yeah,
grateful for those women, the movers and
yeah.
shakers. And then, we save our children. I have a girlfriend who has implant illness right now, and she told me her mom was sick from implants in the 90s. She thought they were different. She had implants, all her hair fell out. She removed her
Oh dear,
implants,
yeah.
all her hair grew back. And then she doesn't have her hair falling out, different symptoms, but same, all that brain fog and all that stuff. And I'll tell you what, my daughter won't have any implants. She won't be dealing with any of that stuff. But because all of these people, and you told me the story about the FDA, and I thought it was so interesting about how they were grandfathered in for the devices. That they weren't always in charge of devices, and then when they took on devices, they grandfathered everyone in unless there became issues. And I've told
Mhm.
that story so many times because you told me that, and I went, oh my gosh, it blew my mind, but it made so much
Yeah.
sense. And then the people that were actually doing the testing were the doctors who were in charge of putting in the implants, right? Did I have it
Well,
right?
yeah, yeah, that's pretty much it. And the other issue, of course, was, there have been some recent exposés that show the FDA wasn't really minding the ship, that a lot of adverse events were being kind of reported. For example, they found over 1,000 adverse events were reported as one event to the FDA. It was a
Wow.
loophole that the manufacturers had to kind of uh, um,
Skate
bunch a
by.
bunch of reports in
Yeah.
one. So, the
Well, they're
FDA has
doing that with
corrected that.
vaccines right now. Not to bring a whole nother
Mm,
topic in, but they're coming up with a couple things like that. So I feel like this is the time. Exciting times is right. This is the time we're going to just band together and good things. And it's the Aquarian stage, all those fun stuff. All the good stuff is happening. I'm excited.
yeah.
Anyway,
Well,
I'm so excited, Dr. Barnett. Sorry, go ahead.
well, yes, hopefully people will listen. And I think it's a beautiful thing that people can educate each other.
Yes, and I'm so grateful to have you on here. I would love to, I know I'm getting some questions, but we have to wrap up. But I would love to see you again. I know everybody else would. So maybe if you have time, we can schedule another live, and we'll get
Yes.
even more time.
Now I think we figured it
We
out.
did.
Sorry.
That's all
So,
right. It was worth it.
yeah, yeah, this will be fine. Just have Nicole schedule it,
All right.
and I'll be happy to talk again.
You're lovely. You're a gem, and I'm so grateful for you and all that you do. Thank you, Dr. Barnett.
And thank you for the work you do too.
We'll talk to you soon.
All right.
Bye
Bye
bye.
now.